So what is anterior cruciate ligament of knee joint? What is the normal structure of knee joint? How this anterior cruciate ligament can be injured? And what are the common signs and symptoms of this anterior cruciate ligament injury? What are the treatment methods and what are the advancement? How can you read your MRI of your own? So in this video, we are going to talk about all these topics. Friends, myself Dr. Vikram Sharma, head sportsmed, Fortis Hospital, Jaipur, and without wasting time, I am going to brief you about the normal structure of knee joint. So if we try to understand the normal anatomical structure of knee joint, this is the thigh bone, we call it femur, this is the leg bone, we call it tibia, and we have four major ligaments which give a strength or stability to this knee joint. Friends, we have two ligaments which are lying in the center of knee joint. These ligaments are called cruciate ligament. The front ligament is anterior cruciate ligament or the ACL, and the back ligament is known as the PCL or the posterior cruciate ligament. Similarly, there are two ligaments on the side of your knee joint. These ligaments are called collateral ligament. Now question comes, what is the role of this anterior cruciate ligament? Friends, so this anterior cruciate ligament is very much needed to give a strength and stabilization to this knee joint. In cases of anterior cruciate ligament tear, this leg bone can move excessively forward, which you can see in this animation. So till now, we could understand that ligaments are major elastic-like structures which are needed to give stability to knee joint. We have two central ligament, anterior cruciate ligament and the posterior cruciate ligament, as well as we have two collateral ligament. These are the side ligament which are needed to give a sideways stability to your knee joint. Now the question comes, how this anterior cruciate ligament can be injured. So primarily there are two mechanisms of this anterior cruciate ligament injury, and the commonest mechanism is the twisting. To explain twisting in a better way, you can imagine if your foot is fixed on the ground along with your leg and your body is twisting in this way. So that means there would be excessive stretch on this elastic-like ligament. And if there is a sudden twisting, there would be excessive stretch on this elastic-like structure. As an example, if you stretch elastic more than its capacity, it gets damaged. Similarly, if there is a sudden excessive twisting, that can lead to anterior cruciate ligament tear. Again, the grading of tear depends on the momentum or the extent of injury. If there is a sudden excessive twisting, the ligament would be tear completely. In cases of mild injury, the tear can be grade 1 or grade 2 tear. Apart from this twisting mechanism, the other mechanism of injury is hyperextension. That means your thigh bone is moving like this. There's a increased extension, and that means your leg is going excessively backward. This mechanism of injury is very common whenever you try to deaccelerate suddenly while you're running in a very faster pace, or similar can also happen during the time of skiing. You must have noticed that during the skiing, a skier try to deaccelerate by hyperextending the knee joint, which can lead to anterior cruciate ligament injury. So till now we could understand what is the normal structure of our knee joint, what is the role of these ligaments, specifically the anterior cruciate ligament, what is the mechanism of injury of specifically saying anterior cruciate ligament. Moving forward, we can also understand what can be the primary symptom of this anterior cruciate ligament injury. So before moving forward, I would also like to tell you that we have a dedicated WhatsApp helpline for you, and the WhatsApp helpline number is 958707722. Whenever you have any such injury and you want to consult a doctor, you can send your MRI report WhatsApp to us, and our team is definitely going to get back on that to give you a complimentary helpline or to give you a complimentary guideline on the same thing. Moving forward, we'll try to understand what are the common signs and symptoms after the anterior cruciate ligament injury. So friends, we are going to talk about the acute symptom. That means if you got sustained any kind of twisting injury which can lead to anterior cruciate ligament tear, what can be the immediate sign and symptoms and what you can feel immediately. So the first sign would be You must have noticed that if you have got a twisting injury, you have fallen down, and if you try to stand immediately and you feel any kind of instability inside your joint, friends, do note that this is almost always confirmative of an anterocruciate ligament injury. The reason is that whenever there's excessive twisting, the ligament gets tear and you lose stability of your knee joint, but you try to stand of your own as you have been doing it previously. But this time, do remember, this time your ligament is torn, so you are unable to do that. As a result of that, you may feel immediately instability, you may feel a fear of falling, and you may feel that your knee is giving way. If this is the symptom on a first try, do note that in 80 to 90% of the cases, your anterocruciate ligament, there's chances that your anterocruciate ligament got injured. The second important sign or symptom which you should look for, that if you sustain a swelling, a big swelling over your knee joint immediately 2 to 4 hours after injury, this is again a confirmative sign of an anterior cruciate ligament injury. Friends, basically we call it hemorrhagosis, that means blood inside the joint. So whenever there is an injury of the anterior cruciate ligament, the blood gets started coming out inside the joint. But as the joint is a closed structure, so there's no way to go this blood outside the joint. As a result of that, this condition is known as hemorrhagosis. So these are two important signs and symptoms of acute anterior cruciate ligament injury. Now we are going to talk about what are the chronic signs and symptoms. That means if this is a delayed case, after 3 months, 6 months, 1 year, 5 years, 10 years, what can be the symptom? The first symptom would be a lack of confidence over your knee joint, or whenever you walk on some of the uneven surface, there would definitely a chance of instability. You will find a fear of falling, and there would be a cautious walking in such of the cases. So please do remember, whenever you have any kind of such symptom, do try to compare your injured leg with your healthy knee. So with this tip, you can diagnose yourself that your ligament or your diseased knee has got a ligament injury or not. So the first symptom in cases of a chronic tear is lack of confidence, cautious walking, fear of falling, and whenever your foot lies to an uneven floor, you may fall it again. The other symptom is you have to take extra caution while you're coming down of a ramp or coming down of the stairs. So if you are finding all these signs and symptoms in chronic cases, please do consider this may be an anterior cruciate ligament injury. In cases of chronic tears, say for 5 years, 10 years, you don't get it treated. In cases of complete tear, there would be a disuse atrophy over your thigh. That means you may find that your thigh muscle started getting thinner. This we call as a disuse atrophy. That means if your knee is not stable, you try to protect it, you do not put your complete weight on that, and you do not do any kind of sports activity with this leg or with this limb. As a result of this is a disuse. That means you're not using your muscles appropriately, and as a result of that, there may be thinning of the thigh muscle. Apart from that, if anterior cruciate ligament is completely torn and this is not treated, there may be damage to this cartilage, which can lead to early osteoarthritis. That means the degeneration started coming in the early age. The degeneration which usually comes in a later age, say 60 years or 70 years, but in cases of anterior cruciate ligament tear, untreated tears, this degeneration can come even in an early age also. So till now we could understand that what are the signs and symptoms of anterior cruciate ligament injury. And again, before moving forward, I'd like to tell you about the WhatsApp helpline 958707722, and you can connect us on the same helpline by sending your MRI to this number. Now the question comes, how your doctor can diagnose this anterior cruciate ligament injury. So your doctor take a complete history. If there is a twisting injury, if your symptom matches to that, then your doctor does some of the clinical tests. We call them anterior draw test or the Latchman test, and with the help of these tests your doctor can suspect that whether there is an anterior cruciate ligament injury or not. And in case of suspected anterior cruciate ligament injury cases, your doctor will send you to the MRI. MRI is a gold standard to understand the anterior cruciate ligament injury. With the help of MRI, we can understand whether your anterior cruciate ligament is torn or not, and what is the extent of this injury. And apart from anterior cruciate ligament, is there any other structure of your knee joint which has got damage along with the anterior cruciate ligament. So in this section, now we are going to talk about that how you can understand your MRI of your own. So friends, there are certain terms which are generally written in the MRI which you should know. If your MRI says this is grade 1 or just a sprain or anterior cruciate ligament, there's no need to worry. This is a very mild injury and the treatment can be done with the help of physiotherapy. Physiotherapy means just the strengthening of your thigh muscle and the leg muscle and some of the medication which helps to heal your torn anterior cruciate ligament. If this is a grade 2 tear, your MRI is saying this is a grade 2 tear. In these cases, sometimes the physiotherapy can be helpful, but the treatment again depend on demand of your knee. That means if you are a very high demand knee, that means you are a sports person, and if you have any symptoms, in those cases the treatment can be done with the help of a PRP, and sometimes the surgery may be needed in grade 2 tears also. But please do remember, if this is a grade 3 tear, near complete tear, partial tear, single bundle tear, in those cases surgery would be needed, but the final decision only can be taken after looking at the MRI scan, that means the plate of your MRI along with the clinical examination of your MRI. So till now we could understand that in which cases the treatment is needed. The treatment can be done either with the help of physiotherapy, sometimes with the PRP, and when the ligament is completely torn, the treatment is done with the help of an arthroscopic surgery. Now we will talk about, in this later or the last part of video, we are going to talk about the surgical techniques of the video. So friends, the surgical technique, I'm not going to too much into the scientific details of the surgical technique, just briefly saying this surgery is known as ligament reconstruction. Reconstruction means that your elastic has got a stretch and now this is of no use. So we have to reconstruct the ligament. That means we have to take a graft from your body, from your muscle, and we create a graft of that, and we place this graft instead at the place of your torn ligament. And the surgery is known as ligament reconstruction. That means we are going to recreate your anterior cruciate ligament. To be more specific, the term is anatomical ACL reconstruction. That means we try to copy your original anterior cruciate ligament and we try to attach specifically at the original ligament places where your original ligament was attached. And the reconstruction is known as anterior cruciate ligament, anatomical anterior cruciate ligament reconstruction. To be more specific, there are certain advancements, like we can call it a single bundle augmentation or reconstruction. That means if your ligament is not completely torn and only a part of your ligament is torn and you are having symptoms, the surgery would be augmentation. That means the graft will be placed only at where your ligament is torn. That means only the torn portion of your ligament will be replaced with the graft. The healthy portion of your ligament would be left as is. The surgery is known as ligament augmentation or the single bundle reconstruction. One more refinement, or you can say the type of surgery, is all inside. Friends, only the difference with the all inside is that we are going to create a tunnel from inside to outside. In conventional method, we create a tunnel from outside to inside, and practically saying there's no difference in the result in both of these technique. And all inside technique rather do require some of the specific instrumentation which can increase the costing of this surgery. Apart from that, one more question which is very commonly asked to me is that whether I use a fiber tape or a internal brace in the cases of ligament surgery or not. So friends, to be very specific, I only use fiber tape whenever this is needed. I'm very clear on that. In cases of female sports person where the graft size is very less, I can get a very less graft size, say 7 or 7.5 millimeter. In those cases, just to give extra strength or to augment this graft, I generally use fiber tape. Or in cases of a very demanding sports person, say in cases of a footballer, generally I use this fiber tape. In other cases, fiber tape is not used. So friends, till now in this video we have talked about all the major aspects of anterior cruciate ligament injury, and in this last part of video I would like to tell you about the recovery time. So friends, the normal recovery time is around 6 weeks. That means the ligament gets a basic union with your bone in around 6 weeks. For mild sports, say running and jogging, this takes around 6 months, and for competitive or the colliding sports like football and rugby, this takes around 7 to 8 months. In spite of using any technique, whether I use all inside or whether I do a fiber tape, the healing time does not get altered. So remain clear about that, because in cases where you go as an early return to sports or early activity without recovery, there are definite chances of re-injury to your anterior cruciate ligament. So friends, in this video we have talked about almost each and every aspect of anterior cruciate ligament injury, its surgery, its advancement, what are the clinical signs and symptoms, how you can understand of your own, how can read your own MRI, and our WhatsApp helpline, that is 958707722. By sending your MRI on this WhatsApp number, you can avail our complimentary guidance. So myself, Dr. Vikram Sharma, Head Sportsmed, signing out. Thanks for watching this video. Do subscribe us. Thank you.